Okay, there you go.
Yes. Yeah. Thank you. And I will play the full screen and just say next. I will do it. Thank you.
All right. Well, welcome everyone. It's nice to see you all. And I had the pleasure of being face-to-face with Peter at our collaborative summit in April in Texas. But we'll be talking today about the developments of the U.S. Health Literacy Association and future collaborative opportunities for us and you all. We were super excited to have the opportunity to sign an MOU with the Asian Health Literacy Association. And we're looking forward to working with you in the future. Next slide, please. So today's objectives are going to be to describe our current policy priorities and initiatives aimed at advancing health literacy and healthcare, public health, and education, present how professional students and organizations can engage in advocacy, collaboration, and leadership within the U.S. health literacy movement. So I'll focus a little bit about what we're doing in the U.S., and then I'll talk at the end about what some global collaboration opportunities might be between U.S. and the Asian Health Literacy Association. Next slide, please. So just a little bit about where we are today. The U.S. Health Literacy Association actually officially launched in May of 2025, so we're just over a year old. So we are still a toddler and trying to get things figured out. But if you'll go to the next slide, please. We wanted to explain a little bit about why we're focusing on policy, because we do have other health literacy organizations within the United States, some of which you're probably familiar with, the Institute for Healthcare Advancement, and then some more regional health literacy organizations. But we started U.S. Health Literacy Association more so to focus on policy, because we know that academic, community, government, industry organizations have been working for decades to understand and address health literacy. And we've well established the reasons, which I'm thinking in Asia, you all probably have too, because it's a global issue. And I've worked, I was on the executive board of the ILA, the International Health Literacy Association, for 6 years. So I've worked a lot globally on the issue. But we know that over time, health information is not getting more simple as we would hope, but it's become more complex and more directly available to the public. So there's more confusion. And misinformation is increasingly common, with people frequently relying on online content that may be inaccurate or misleading. And I was actually reading an article today that stated that the digital movement of healthcare and using health portals and all of those things is actually widening the gap in those who cannot understand how to use or find health information. Especially people with low English proficiency in our country, and also older adults who, may lose cognitive ability or aren't tech savvy. Next slide, please. So what we know is that thus far, policy has failed to address health literacy, and that has had considerable personal and community level consequences. In fact, we have worse health outcomes in our country, higher health costs, which just are escalating. It's much harder to access healthcare, even if you have insurance and are a medical professional. So that even widens the gaps more in equity for people who don't have insurance or who don't have access to care, such as in our rural communities or our underserved communities. And I'm willing to wager that you all have some of these same issues, but also reduced trust in the medical system because of this lack of continuity of care and inability for patients to be tracked and followed well, and making sure that they can progress in their journey to health. Next slide, please. And we know that the system is getting more complex over time, and it's well beyond most people's level of understanding. So we need people who can help navigate the healthcare system, not only healthcare, but health insurance and public health are all issues. And we know that misinformation is rampant because people don't know where to go for reliable and valid information. There's growing challenges to find information with losses of vetted information from traditionally trusted sources. And they don't know where to go. And that's why I do a lot of work with community health workers in our country. They are people who work in our communities who kind of bridge healthcare and the community because they have a level of understanding of healthcare, and then they can translate that culturally and logistically to people in communities who may not have the ability to understand or navigate on their own. Next slide, please. So we know that there's an over-reliance on online health information, and many people are self-diagnosing, and that they are finding sources that aren't necessarily reliable or trying to sell them things, or promising miracles, or promising things that they aren't going to be able to deliver. And AI generated information is now more used by our patients and just people in general. And so we know that there's a whole other, thing we could talk about in terms of AI generated information and its lack of credibility when it's pulling from unreliable sources or making up things if there's a gap in information available on the internet. And so we know that people, patients, families, and even some providers may not recognize inaccuracies because the content is often well written and sounds confident, but it may not be evidence-based. And so one of the things that we talk about is the fact that you still need that expert. You still need that person who knows what they're talking about or who knows the field and knows the evidence to be sure that that information that is generated is actually reliable. Next slide, please. So the health literacy efforts in the U.S. have had varying levels of formal organization. The federal government agencies had gotten into it for a while. Right now, there's kind of a step back from that as they're focusing on other things. But we do know that some states have organized. I've kind of led that organization in Texas. But there are other states that have some health literacy efforts and about 5 or 6 that have some semblance of some legislation. In Texas, we've had legislation up for vote in the last 5 sessions, which spans 10 years, but it's never passed. And it's become somewhat politicized because of different things that different politicians or different parties in our country prioritize that makes it political when it shouldn't be. Everyone should want people to understand health information. So we know that the U.S. Health Literacy Association has emerged to drive a more coordinated and systematic leadership effort to advance health literacy policy in the U.S. in hopes that if we have an overarching policy structure and understanding that will trigger the states to follow suit. Next slide, please. So the organizational structure of the U.S. Health Literacy Association, we have our board of directors that you see here and that Peter met when he was here for our conference. But we also have what we call regional coordinators. So these people are over the different regions of the country, and you can see that they're kind of broken out there in the different colors. But our goal there is so that there's some leadership to help drive the U.S. Health Literacy Association efforts in each of those regions, because it would be difficult for the board to be doing that work, right, in those smaller chunks, and making sure that things are moving along. And then we have our task force chairs, and they have specific strategic responsibilities such as membership building, partnerships, policy, and legislation. So that person would like review what policy and legislation already exists and how can we make it more global. Sponsorship and partners and fundraising, of course, would be the financial aspect. And then advocacy and public awareness would be kind of driving what we're doing and making sure that it's being communicated. And then just for our more commercial communications, we have a communications and marketing specialist. Next slide, please. So kind of our updates from our first in-person meeting, if you'll go to the next slide, is that we wanted to build networks and partnerships. So we, at the Collaborative Summit, we had a session specifically that was a meeting of the U.S. Health Literacy Association. So we brought together people to kind of champion and join, of course, the U.S. Health Literacy Association. And then we encouraged them to meet in each of their regions so that they could identify local needs and policy opportunities. Of course, we wanted to increase membership and engagement and share resources and best practices across the regions. Next slide, please. So thinking that with membership and recruitment, we're going to grow and engage our membership, advocacy and public awareness, advance policy and influence, and of course, amplify our voice and visibility through communications and marketing. Next slide, please. And I'm sure that you all do these things within the Asian Health Literacy Association, so it's probably not new to you, but it is, you know, the efforts that we're making to advance health literacy policy in the U.S. So we have a portal where we hope to have everyone engaged. So we want to have conversations about what's going on around the country. We want to have resources in there. We want it to be where people can go and meet up. So instead of like a Zoom meeting, people could have informal chats about what they're doing in their region, but just making it a very friendly space where people can share the work and collaboration and conversations that are going on around the country. Next slide, please. So in all of that, we have our vision and our 3-year roadmap of where we want to head now that we've gotten past our first year of just building infrastructure. So next slide, please. So our policy vision is that we hope that health literacy would be recognized as a foundational component of high quality care on par with patient safety and clinical effectiveness, which I'm sure you all address in your organization. At one point, we reached out, we have the Joint Commission for Accreditation of Hospitals in the US, and we reached out to them at one point, hoping that they would declare health literacy a patient safety issue. But when they responded to us, they said, well, we need more evidence. So of course, there's always that drive to bring together the evidence to get policy passed. And so that's going to be one of our major tasks, is collecting evidence and funding and doing studies that help us to bring that evidence to fruition, because most of the evidence in the US at least was done, the foundational studies in health literacy around 2009 to 2011. So you can imagine we need something more recent. So we know that when individuals cannot access, understand, or use health information, the result is preventable harm, increased costs, and widening disparities. So that would address all of the things of why health literacy should be a foundational component of high quality care. Next slide, please. So our policy vision is that, if we know we want a quality standard that ensures organizations embed clear communication into their care delivery, that it's a safety priority that reduces errors, misunderstanding, and adverse outcomes, and it's an equity imperative, which addresses systemic barriers faced by underserved populations in the U.S. So we want to advocate for integrating health literacy into accreditation standards, as mentioned with the Joint Commission, reimbursement models, and public health frameworks. So making it front and center in all of these policies and strategies that rule our healthcare systems, but we're not there. And so health literacy needs to be there. Next slide, please. Building organizational infrastructure to support members in developing policy. So we want to make sure that not only is it, national, but also coordinate policy infrastructure so that they can drive policy at the local level. So toolkits for engaging their hospital systems, public health departments, and community organizations, templates for resolutions, institutional policies, and advocacy campaigns. And I know personally, even before I got involved with the U.S. Health Literacy Association, I was doing all of these things in the state of Texas, not knowing that, it was something we really should be doing, but just knowing that it lacked. And so trying to drive change here. And then training on communicating with local decision makers and boards. So we're going to offer all of these services to help empower those who perhaps didn't know how to do these things or didn't know that these were the foundational components of how you drive policy. Next slide, please. So on a regional level, of course, we'll have the regional coordinators that I talked about convene stakeholders and identify shared priorities across the states that they encompass in their regions. But then also collect regional data to support our policy arguments. And that goes back to, needing evidence in order to get things changed. Next slide, please.
Yes.
And nationally, we want to set a federal policy agenda that's aligned with member priorities. So we kind of hope that, it'll start from the grassroots and then feed up to us so that we know what their pain points are and we can advocate nationally. Not that we don't already have some ideas, but, we want to be sure that we don't miss anything. And also developing policy briefs, white papers, and legislative recommendations. And I think perhaps internationally, this is some of the places that we could partner with the Asian Health Literacy Association in global policy in terms of white papers and other evidence-based collaborations that we could potentially have together. Coordinated advocacy campaigns. Again, I think that can be international as well, targeting agencies and lawmakers, but also, partnering globally under international organizations that can affect change as well. And then position the U.S. health literacy as the go-to policy voice in the United States. Next slide, please. So we'll establish ourselves as the leading authority on health literacy policy by investing in a coordinated policy infrastructure that empowers our members at every level. And I've kind of walked through that already, but making sure that we have evidence-based policy statements and recommendations, that we are a trusted resource for policymakers, media, and partner organizations. And in some states, like in Texas, we've established that now. But we just want to bring that nationally. And we also, I know in Texas, fighting the politics is the biggest struggle for us. Building a visible presence in national conversations on healthcare quality and equity, and developing spokesperson capacity with leadership and membership. So we want all of our members to feel comfortable speaking about the needs for policy and advocating for those who can't advocate for themselves. So success will look like that our policymakers in the U.S. proactively seek our expertise when shaping legislation, regulations, and standards. And I know in Texas that our legislators do come to me when they are going to write bills that will go up for legislation. It's just a matter of getting those bills through the legislative session. That's the issue. Next slide, please. So in year one, we want to build a foundation and build our visibility. So we want to define and publish our policy priorities, making sure that it's a clear member-informed policy agenda, publish a flagship State of Health Literacy Policy report. So we'll be doing some literature review and kind of looking at like what states actually have policy in place and what do those policies say, and kind of bringing together all of that language. And then aligning our messaging across all of our communications channels. We want to expand our partnerships across local, state, and national organizations. So making sure that we're partnering with organizations that already exist, that are doing work like IHA, and then the Institute for Healthcare Improvement, which is another international organization located here in the U.S. Engage with associations, advocacy groups, and academic institutions, which many of us who are members of U.S. Health Literacy Association are embedded in academic institutions. And then identify policy champions within partner organizations who can be champions for our work across the country. Next slide, please. We want to launch state level policy listening and landscape scans. So like I mentioned, making sure that we know what policy is existing and what policy is up for vote at the current time, or that's being worked on in different states or regions. And then of course, grow our membership, which I'm sure is something that you all work towards in the Asian Health Literacy Association as well. But our goal is 25% new members, and then at least one new organizational partner in each region by the end of this next year. So by May of 2027, which will of course help to strengthen not only our membership, but also our financial sustainability. Next slide, please. And then build our visibility, increase our presence at conferences, webinars, and policy forums, publish op-eds, blogs, and social content on health literacy policy, and begin positioning us as leaders and of thought in policy in the U.S. So I've managed to do all of this in the state of Texas. It's just going to be a matter of upscaling it to the U.S. Next slide, please. So year two, we want to deepen our engagement in policy and systems stakeholders. So building on the foundation of year one, collaborate with our federal agencies, so Health and Human Services, Centers for Disease Control, CMS. That would be 27 to 28, which right now the leadership in our country is kind of prohibitive to those types of partnerships. So hopefully things will change. We want to also develop relationships with accrediting bodies so that we can embed health literacy in the standards for the different healthcare professions, which we've made some headway there, I'm glad to say. And then state coalitions, of course, partnering with our multi-sector coalitions to advance state-level legislation and implementation efforts. And then support alignment across the states, which would help to reduce fragmentation and amplify the impact. So kind of having a coordinated voice across the country versus having, little bits and pieces here and there from the different states or regions. Next slide, please. So we want to accelerate adoption and reduce barriers. So create practical, ready-to-use policy resources, so contracts and procurement standards, just basically aligning the language aligning policies and protocols within organizations. I'm sure you all have seen the Healthy People 2030 guidelines for organizational health literacy. So a lot of people have turned to doing work in those areas, but also have even branched into making sure community-based organizations are health literate, because we know in the US, many people seek their healthcare from these trusted community-based organizations versus going to our healthcare systems. And then making sure that our systems actually are health literate, because many times it's the system infrastructure that impedes people's success at getting well, which makes no sense because that's the reason they're going in the first place. But embedding health literacy into workflows, quality improvement, and compliance structures. So making sure that these tools enable our members and partners to move quickly from intent to implementation, because we know a lot of the times we can have awareness and we can have intent. You know, we all go to conferences and we're like, yeah, this is great. We need to do this. And we think we're going to take action, and we get back to our jobs and we get bogged down in doing our jobs, and we don't take the action or implement the new thing that we wanted to do. So we want to make it easy. Next slide, please. We also want to make sure that we're talking about AI and the, you know, all of the things that I mentioned before, is making sure that people understand that AI is not necessarily evidence-based. And so we want to make sure that there's transparency, explainability, and usability in AI-driven health tools, because we know a lot of providers and healthcare systems are relying on them now to help with diagnosis. Promote standards that ensure patients can understand and act on AI-informed recommendations. But first, the standards and making sure that it's actually accurate and will enhance clinical outcomes. So also technology decision-making, knowing that people know how to use digital health tools, patient portals, and communication platforms as they are selected and designed. I know I'm also a registered dietitian, and so I've been at people's homes, and you know, they don't have any idea about how to use the glucose monitor that's sending data to their healthcare provider, so that their healthcare provider can, you know, make sure their care is correct. So, you know, it's really important that we make sure that people know how to use those tools. So promoting user-centered design and equitable access as a core criteria. So it positions health literacy not as an add-on, but as an essential to innovation and digital transformation. Next slide, please. So year 3 is going to be measuring impact and hopefully developing sustainability. So we want to solidify credibility and demonstrate value from the U.S. Health Literacy Association, which we'll systematically capture and share our outcomes. We'll be tracking our policy wins in legislation, regulatory changes, and institutional policy adoptions, system adoptions, and then also we'll track case studies and impact reports where we've made a difference in improving outcomes, reducing disparities, or delivering cost savings. Next slide, please. And we know that sustainable impact requires a broad, engaged base of advocates. So that's, you know, obviously our goal is to continue to grow state and regional advocacy networks through membership and regional coordinators, build leadership capacity among members to serve as policy champions and spokespersons. So having policy strategy meetings and trainings. As a registered dietitian, I went through that earlier in my career because we used to have to advocate to keep licensure in our state. But luckily now that's been embedded, so we don't have to do that every 2 years anymore. But that just goes to show you, if you can work hard enough to make it sustainable, then you can move on to the next thing instead of having to constantly worry about, is it going to stay? And then strengthen connections between grassroots efforts and national strategy. So it creates a coordinated multi-level advocacy ecosystem. Next slide, please. We also want to be sure that we have sustained funding and strategic sponsorships, and you all probably know as well as we do that you can't continue to do work without funding. So we want to hopefully engage our healthcare organizations, foundations, and industry partners to invest in the sustainability of health literacy and of our policy strategies to make sure that it's embedded in what they do. Because many times in my work, I know that, you know, if it's nice to do and not required, and they have so many other required things that they have to do, then it just gets pushed to the side. And so we want to make sure that it's required. And so we also want to pursue federal, state, and philanthropic funding opportunities that are tied to policy, equity, and innovation, and revenue generating initiatives such as training, certification, and policy consulting. As mentioned, sustained funding enables growth, innovation, and policy leadership. Next slide, please. So from strategy to action, we kind of talked to our members about how they can engage. And so in the next slide, you know, individually, and this is kind of how I started in the state of Texas. Really, I was transitioning careers and was in school and kind of learned that I had gotten a job at a literacy organization here in Texas as I was transitioning through my doctoral program, and soon found out that they could not fund my salary. So that's what kind of put me on the path of advocacy, because I was like, this is ridiculous. There's funding for literacy in Texas, but not health literacy. And so, you know, I began my work with community-based organizations as an individual, and then moved to organizational. But again, all my work was not effective if it wasn't sustained, and we don't have policies that enforce health literacy in Texas, or much less in our country. For them to embed these things, they would do it temporarily, or they would develop trainings, et cetera, but then it would just fall by the wayside. And so we hope that by aligning these organizational standards and accreditation standards and all of the different things that I've talked about tonight through the U.S. Health Literacy Association, we'll be able to create that sustainability on all levels. So also policy and system level engagement through advocacy initiatives, task forces and coalitions, community partnerships, and policy development and feedback. Next slide, please. So again, you know, of course, we encouraged everyone there to join and connect with their regional coordinators, and then also explore the membership portal that I showed you earlier. Next slide, please. And then I guess there's supposed to be a picture here of the portal, but it's not.
Oh, here. There you go.
So this is just what the portal looks like when they first come in. It's a custom online community engagement platform hosted on our Healthy Community Engage. And it's a way, as I mentioned earlier, for people to connect, engage, collaborate, and meet with other members. Next slide, please.
Should I go further?
Yes, please.
Yeah, all right, okay.
So this just kind of shows you like all of the different things that they'll be able to get on the portal. So resources, members can join and find out information about what's going on. There'll be an ongoing feed, and then they can also chat amongst themselves or with the board, whatever, you know, their need happens to be at that particular moment. Next slide, please. And of course, it encourages them to set up a profile and be active. So we know that for health literacy to be sustainable, it has to move from best practice to standard practice and then required practice. And right now, it's only at best practice, and it's been there for decades, at least that I've known of. I didn't start in health literacy until about 2012. So, a good almost 15 years now. Next slide, please. So some of the things that we thought about in terms of joining forces with the Asian Health Literacy Association is potentially publishing joint white papers or position papers, collaborative virtual trainings and conferences, potentially in-person conferences as well. Right now, with the state of the US government, it's very difficult for us to travel internationally to conferences, much less a lot of our funding has been cut. So many people don't have funding to travel. And then there's particular regions that are banned for travel. And then we also hope to strategically partner on potentially some grant-funded global initiatives as well. And so now I will open it up to you all, next slide, for questions and potential thoughts on how you see us collaborating with you.
Thank you so much. Teresa, should I offline the PPT?
Yeah, that's fine.
Yeah, okay. Thank you so much. Really comprehensive about this, and I know Charles may have question later on, but I would like to reflect. It's just so important for us to understand. You said 2012 you started, but we start not too early. And one difference between Asian health literacy and what you have achieved is that we don't have we are very fragmented. Every country have their own. We don't have for example, WHO is particularly interested in health literacy in Europe. Not too much in, I see not too much in Asia Pacific region. So there's no concept about health literacy regard what you have just mentioned. That is the one difference. The other is that I like the strategy you go that we don't have a very strong legislative power on this yet. So we are still in the early morning of what you are doing. So, but I appreciate it. And so, but anyway, Charlie may have a question. Charlie.
Yes, I'm here.
Charlie work on Asian health literacy, not only as a Taiwan Association Secretary, but he also work in Asian health literacy quite intensively. So Charlie, you have any question? Yeah, please.
Yes, Teresa, I just wondering, like you mentioned that the AI can help you to enhance this kind of health literature. So what is exactly we can do with the AI to promote this kind of health literacy without the people have no idea about some kind of, the multimedia or digital or some kind of online work, and to understand that AI can help them out? Thank you.
Yeah. So, AI can help you gather a lot of information in a very short period of time.
Indeed.
It also can help, like they've developed tools now where providers can put in symptoms and, it can help them to diagnose patients. But the caveat is that it's not always accurate. So you always have to check, what it is that it has generated. So I'll give you some examples because, when we first, I don't know, have you used ChatGPT or any of the AI?
Oh, indeed, yeah. ChatGPT, Gemini is all included.
Okay. So when we first, started hearing about AI and everybody's like, oh yeah, it's going to replace us because it's going to be able to do health literacy without, us having to do anything. And so I'm like, okay, well, I'm gonna see, So I took some verbiage and put it into ChatGPT, and I said, make this health literate, and it said it had, and so then I tested it, and it wasn't. And then also, if you go and you check the references, many times the references don't match what ChatGPT pulls. And so, and then it does, and you may have already heard this term, but it will hallucinate, which means that it pulls information when it doesn't have an answer. It'll just randomly pull other information to fill in the answer. So you don't know for sure that it's even accurate. So you have to still have your professional lens on, even though it can help, speed up the rate at which you are working. You still have to go back and double check it. So it's a give and take.
Oh, indeed. I appreciate that, Teresa. That is a really good idea. But just like you said, they have a bias between like the AI and some, the people who are using. So I'm totally agree with that. And hopefully we can use this as a tool and help people can understand more about health literacy. Appreciate that.
Yes, for sure.
Well, following up the Charles' comment that there's been a rationale that for a lot of lay people, the public, the general public, AI, are they helping them? Charles just says, is the AI helping the general public getting better health literacy, right? Certainly, you talk about the risk and some uncertainties, but a lot of people now this AI has been a fashion. People are not using digital health tool too much, but now they find AI is so easily be adaptable to them, even they don't understand too much. And now they are prone to having more question on health issues that so this is one drive. I'm wondering how do you see this?
Yeah. So interestingly, one of the projects that I did several years ago was called WebLit Legit, which is a toolkit for the lay public to be able to take a website. Let's say you get on your phone and you're like, oh, I have a sore throat or what have you, and you just Google it. And then it brings you like different websites that you can explore. And so I was teaching them, like, how do you know if that website is credible? And so they would go through different steps. Well, now most, especially young people, will get on their phone and they ask the question, and the answer will come back, as you probably know, AI generated, right? It'll summarize what's on those websites instead of giving you the websites. So now we're developing a tool to help them, follow that information, like what were the sources that the information came from, and then were those sources credible? So teaching them, we're calling it WebLit Legit AI. So making sure that they're going and following up on that information rather than just taking it as fact. But it definitely, as you mentioned, is a risk that potentially people could follow information that's AI generated that has hallucination in it, and they could end up harming themselves versus helping themselves.
Yes. All right. I would like to maybe Haifa, the other have question, but I would like to reflect when I met, I have an invitation for you to join AHLA, and in November is Thailand. We always have that around the health literacy month in October. I know it's quite maybe a relative particular on heavy calendar for you during November. Would that be possible? We can invite you for online. We always have a national comparison. Every time we have international comparison, quite a 10, 12 countries, they talk about what's going on and what's the difficulty, maybe some achievement. Would that be feasible? If time is really available, we can invite you to join as a hybrid. Usually we don't have a lot of hybrid in ACLA, but in this case, we occasionally we can arrange that. If you see this is possible, I can send an invitation and come up with some idea that we can learn from you. We don't have a regional, again, we don't have a regional strategy yet. The most important that we go to different states and empower to support their network group. That is most of activity we are having in Philippines, Thailand, Vietnam, very much in Thailand and Indonesia, quite a few. And I went to Kazakhstan sometime, but we are still doing the presentation. And so I'm wondering that might be very generous of you to be at least on our hybrid, the panel discussion.
Yeah, I'm open to doing that.
Yeah, thank you so much. I don't know whether some of our colleagues still will have some questions. And I find that quite a lot of information you just present very interesting. To us, some of them we have never. For example, policy, we don't really in a good way to do that. And some of the, we have very strong Japanese Health Literacy Association, and I want to be engaged, and I want to be, they said that we are totally in Japanese. they are not really ready to go internationally. Maybe in the future we'll be able to do that. Charlie just mentioned we are running this year. We are doing a local grassroots training program, quite 9 to 10 times. We want to have people, a professional, they know how to use health literacy, how health literacy could be useful. And we are also in the same time to discuss, we can go to legislator to come to see any, we can integrate this in part of the rule change ongoing. So we are still having a lot of work, but with this, I find you have a tremendous amount of work ahead of you. It's unbelievable.
Yes,
it's unbelievable. It's really encouraging. Really encouraging.
Yeah.
Yeah.
Yes. Well, it's what we've, at least I personally have been doing for 15 years now, and many of my colleagues have been doing it for much longer. So.
Okay. Charlie or Haihua, you have any further questions?
Oh no, Teresa, this is in Texas. Now this health interest is doing okay there, right? Is that in Austin or in some kind of Kansas or something?
I'm
Is that-
sorry.
Is that in Austin in Texas?
Oh, I'm not in Austin. My daughter lives in Austin,
Okay.
but I'm in Fort Worth. Have you been to Texas?
Yeah, well, I was studying Austin before.
Oh,
Yeah.
okay.
It would be
That's
great.
that's where I studied for a while, and so did my daughter.
That's good. But anyway, appreciate that your tremendous speech, and hopefully we can cooperate with you and our director Peter Zhang will be. Hopefully we can just invite you to come to our meeting as well, and hopefully we can have a long-term relationship and keep going to promote this kind of health literacy. Appreciate that.
Sounds great.
Yeah,
Yes.
I hope, Charlie, you'll be in AFLA in November and we can work on this, that coordinate such a partnership and experience sharing. And all right, so it has been take you a whole hour, more than an hour, and I wish you have a beautiful weekend to come.
Thank you.
And hope to see you soon again, and stay in touch. Thank you so
All
much
right.
for all the people online. Thank you.
Thank you.
Thank you so much.
Bye, Charlie.
Bye.
Thank you.